Hey there, welcome to the show. Today's guest is Dr. Anna Duarte, a medical doctor and expert in anti-aging and longevity medicine. She's also the founder of Eusari, a science-backed wellness brand for women in midlife. After 15 years in pharmaceutical research, Anna hit her own perimenopause wall and realized just how overlooked and under-supported women are in this stage of life. Now she's on a mission to change that, helping women feel like themselves again with non-hormonal solutions. Thank you so much for being here, Dr. Anna.
No, Claudia, thank you for inviting me.
Yeah, I'm excited to
And
have this.
please call me just Anna.
Anna. Okay. I'm excited to have this conversation because, while I advocate for HRT and I use it myself, there are a lot of women who either cannot take it, or they choose not to, or it's not accessible. So it's certainly a personal decision, and I really do believe that women should have the information and then make the best choice for them. So let's kind of start with the basics. Can you explain why some women can't take HRT or don't want to take hormones? What are some of the barriers, whether it's medical, contraindications, or access?
Yeah, I think that there are three main things. The first, medical issues. So there are some absolute contraindications to HRT. For example, having an active liver disease or maybe an unexplained vaginal bleeding. So there are a couple of things that definitely we know now that are big no's um, to start HRT. Then there are some things that we have to be cautious with, clotting disorders, history of breast cancer, especially those hormone sensitive cancers, which today we know that are not absolute contraindications, but that we need to be careful with.
Mhm.
And then there is a percentage of women, and we don't talk about this enough, that don't tolerate HRT or that they feel that it doesn't work for them. And that's, there are few studies, unfortunately, but what I found reported is between 17 and 20% of women say that they are not fully satisfied. Okay. That doesn't mean that they are not going to take it anymore, but there is a big amount of women that doesn't feel perfect with HRT. And that's normal. In
Yeah.
fact, that happens with every drug. I mean, if you see painkillers or anything that you use today, some people don't respond to that. And that's why, for many diseases, we have several options to
Yeah.
treat something. So that's medical issues. Then there are some access issues.
Mhm.
And of course, maybe you don't have access to the proper doctor. There are issues with insurance. And then there's a third factor that I think that still holds many women and many doctors from prescribing HRT, and is the FDA black label.
Yeah.
So we know it shouldn't be. There's a lot of women advocating for that to get removed from estrogen products, but the fact is that today it's there.
Hmm.
And that generates issues not only in patients, but also in doctors, because they say, okay, here it says that it causes breast cancer. How can I safely prescribe something that is not meant to, according to the FDA? So
Right.
it's still a big barrier. And finally, personal choice that you just mentioned. Um, and some people prefer natural remedies or trying um, like natural paths in general for their health.
Mhm.
Um, but also, some women have negative experiences around their life. So, let me give you an example. There are people that are afraid of flying, for example,
Mhm.
and you can tell them that it's much safer than driving a car, and they know the numbers and they know that it's a fact that it's like you can die in a car. The lifetime risk of dying in a car is 1 in 100.
Mhm.
That number for planes is like 1 in 10 million. I mean, the difference is huge.
Right, exactly.
You have a good reason to believe that it's safer, but still you are afraid of flying.
Hmm.
And many experiences can generate that kind of feeling. And for example, if your mother died from breast cancer, or a good friend is going through breast cancer, of course that is gonna have um emotional load for you,
Hmm.
that it's significant, and we need to respect that.
Yeah.
So from that personal perspective, we have to understand that not every woman want to go into HRT. Although I agree with you, HRT has great benefits. It definitely improves symptoms, but also in terms of prevention, we know that it's great for your heart, for your bones, even for your cognitive
Yeah, thank you. That was a really great answer and very thorough. You touched on so many important points. The fact that you said 17 to 20% of women, at least from what you see, react poorly to hormones. I mean, we see it too clinically in practice. Women go on it, they're very excited, and then once they start, they feel pretty lousy. And we do try to educate women that, hey, sometimes you may feel worse before you feel better, but nobody wants to feel bad. And
health.
sometimes they don't have the patience, they're not able to, especially if they're working moms. So we really do have to be aware of that and of course sensitive to that. But then like you said, access, like even just finding a good doctor who's going to prescribe
Yeah.
hormones, who knows how to, who understands hormones, who understands the contraindications. Especially nowadays there are women who are on other medications like SSRIs,
Mhm.
and certain things may impact that. So I love that you spoke on that. And then even, yeah, that personal, the emotion around it. Because, like you said, if somebody is really fearful of something, whether they had somebody that they lost who had breast cancer, that is very real. And our nervous system doesn't forget some of these negative
Yeah.
memories or trauma. So, yeah, thank you for touching on all that because I do think that sometimes, especially in the online space, even though there's a lot of people who mean well and they talk about how wonderful HRT is, sometimes the compassion is not there. And you seem to have it. So, thank you.
Um, but also, I mean, medicine is very complex,
Hmm.
and the body and the biology of body is very, very complex. And we try to simplify things to understand them, but then there are so many loopholes and things that sometimes you think, okay, this is gonna be perfect for me. Everyone is doing it, but at the end, it doesn't work as you wish. And then we have to understand that, unfortunately, um, we haven't found a way to make precision medicine yet,
Mm.
and to find a way to really deliver exactly what a person needs for their symptoms, for their system, for their metabolism. That's something that we are unfortunately far from. There are some groups working on that, but still, we're not there yet.
Yeah, and thank you for saying that because I think when it comes to medicine and just health in general, we need to stay humble because there's so much that we don't know.
Mm.
We've come so far, but yet we still have so far to go. Just going back to, the women who either can't take it, choose not to, what are they looking for in regards to alternatives to HRT?
So people are usually looking for relief from their symptoms,
Mhm.
more than prevention. That's something that people are learning more about, but we mainly think about today, right?
Yeah.
We think a lot in short term. So people are looking to relieve their hot flashes, their fatigue, etc. And definitely lifestyle changes are very important, and people are continuously looking for advice in those. Exercise definitely is probably the most studied, but also the most potent intervention in health today. But then also sleep hygiene, a healthy diet, stress management, all those are important. And then there are a couple of things that, as alternatives, definitely there are some prescription alternatives. We have to say vaginal estrogen, even that we think about it as an HRT option, I think it's not the same in terms of it's gonna have great effects locally, and it's very safe to use. You can say that probably there are no contraindications except allergies or things like that, but it's very safe. That's one. There's also Veoza, which is a new drug
Mhm.
that it's basically for hot flashes. So it doesn't help with a lot of the other symptoms, but for people that cannot take HRT and that are crazy with the hot flashes and the night sweats, Veoza can be a great alternative. And then some of the older things that have been studied and approved to treat menopause symptoms. There is paroxetine, that's an SSRI, an antidepressant, and gabapentin, another drug that help because they act in your brain and they help especially with those symptoms related to hot flashes, night sweats, and a little bit around the mood part. Um, then there are other types of therapies. Acupuncture is something that has gained a lot of traction lately. I'm not an expert, but there's a little bit of science behind it, and people definitely report feeling better with acupuncture and also cognitive behavioral therapy.
Mhm.
That's a kind of psychotherapy. And people that feel a lot of distress with their symptoms definitely feel better with this kind of therapy. And then you see a lot of women looking for supplements
Mhm.
for their symptoms.
Thank you for that. I think it is important to let women know that there are some medications out there, and of course supplements. Supplements we can talk about that probably for an hour, if not longer, because there's so much out there.
Yeah.
But the reason why I wanted to have you on, not just for your knowledge on everything we've already talked about, but the fact that you created a product that has an ingredient called Equal in it. So can you talk about that a little bit? What it does, why you came across it, what made you create the supplement, and just give us a little background in terms of the science behind it.
Yeah, so basically the most popular supplement to treat menopause until now has been soy. And soy basically it's very good because it's full of phytoestrogens. And phytoestrogens are basically nature's version of estrogen. You can find it in soy, but also in other foods, lentils, even in fruits, you can find phytoestrogens. And that's the supplement that has been studied the most, definitely. I mean, in every part of the world, it is used today as an alternative for these kind of symptoms. But when I started investigating and researching all of this to understand what could be the best option for patients, we saw that with soy, there are inconsistent results. Some people say they feel much better. Some people say, I don't feel anything. And what they have discovered is that soy is full of two components, daidzen and genistein. But daidzen, which is the most potent of the two, is really converted in your gut into a qual.
Mm.
So it's like it needs that activation for your body to be able to use it to really work in the estrogen receptor,
Yeah.
like estrogen would. And qual is more potent and it has a higher affinity for the estrogen receptors than any other phytoestrogen. The problem is that only 20 to 30% of American women can convert Daiitzen into a qual
Okay.
because we don't have the gut microbiota to do that.
Mhm.
Why? Probably because our diet does not contain soy naturally. It's not something that we eat. Later in the last 20 years, maybe we
Mhm.
have included it more because, the Asian culture has brought a lot of those delicious foods that we love and
Mhm.
everything, but it's something new and still it's something that you eat maybe once a month or yeah, it's not
Yeah.
part of the regular diet in the Western world. So um, they have studied this trying to find women who are equal producers and women that are not equal producers. And they found that women that could convert Dyson into equal suffered from much lesser symptoms and complain from less symptoms of menopause than other women.
Mm.
In fact, if you see in Japan and China, usually women say that they don't feel as much symptoms as Westerners do. And it's probably because of this, because they eat a lot of soy.
Mm.
They can convert that soy into a qual, and they use that as part of their diet to feel better.
Yeah.
Um, so a supplement of a qual really bypasses that process and
Mm.
gives you the benefit of a phytoestrogen without you having to change dramatically your diet or having to try for your gut to change, which is not easy, honestly.
Yeah. No,
That's
it's not.
very complicated.
Especially
That's very
nowadays
complicated.
with diet, stress. I mean, we have a lot of toxins that we're exposed to. I mean, and then our
Yeah.
gut microbiome shifts in this stage of life. So, I mean, it's incredible. So you actually created a supplement called Menoplay that has a qual in it. So can you talk a little bit about how that works? Can it be taken alongside HRT or is this in lieu of?
Mhm. So I'm gonna answer your second question.
Mm.
The answer would be no. I wouldn't recommend that because Equal acts like estrogen. Okay,
Okay.
it's less potent. It's more selective than
Mm.
estrogen. So it is more selective, especially for beta receptors,
Mm.
which I call the good receptors because they
Mhm.
are the ones responsible for the anti-inflammatory, the anti-proliferation, and the neuroprotective part of estrogen. Not like alpha receptors that are more frequent in the breast and then the endometrium, and that's the part that we don't want to promote. You don't
Yeah.
want your endometrium to grow. You don't want your breast to be the growth of breast cells promoted by estrogen. You don't want that. So I always say that the alpha receptor is the bad one, the beta is the good one, and we
Yeah.
want to be selective. Science right now trying to improve HRT is looking for that, for selectiveness, so that we can give more precise treatment for menopause symptoms.
If you're struggling to navigate the overwhelming world of hormone replacement therapy, feel dismissed by doctors, and can't afford to spend thousands to get help, check out my brand new course, Perimenopause HRT Roadmap. This easy to understand self guided course is designed to give you clarity, confidence, and knowledge to decide if HRT is right for you. No fancy health jargon that'll leave you confused, no black and white thinking that leaves you feeling alone and without options. With Perimenopause HRT Roadmap, you'll have a much better understanding of HRT, gain confidence to advocate for yourself, and feel your best in perimenopause and beyond. Get all the details in the show notes.
We went out to look for a good equal because
Mm.
in supplements you have to find good sources for your ingredients. When you are trying to formulate a supplement, you have to be very careful of where you find your raw materials and make sure that they are good quality, that they are pure, that they are effective, that they have been studied for whatever effect we're looking for, right? And we found this beautiful ingredient called Resequol, which
Mm.
is patented, that it's made in Italy, and
Mm.
that they basically take a qual from soy, and they put a little bit of resveratrol to make
Mm.
sure that it has a lot of antioxidant capacity. And they have studied it with randomized control trials against placebo, and it shows improvement in hot flashes, in heart discomfort, in sleep problems, in depressive symptoms and irritability, in fatigue, sexual problems, bladder problems, vaginal dryness, joint and muscular pain. So it really
Wow.
shows all those effects that estrogen have. Of course, as I said before, the affinity of a qual to to the receptors is lower than estrogen, and that's why you don't have the secondary effects that estrogen has.
Mm.
So that was base for our supplement. And then we decided, again, not everything works the same for everyone. And we wanted to add a couple of things so that we could have a complementary mechanism of action. And that's a concept that it's very important when you are trying to treat anything.
Mm.
You want to try to tackle things from different perspectives. Like if you want to lose weight, you have to exercise, you have to diet, you have to manage stress. That's three different approaches to one problem. So we wanted to do exactly that. And we decided to try black cohosh.
Mhm.
Black cohosh is Native American. Tribes use it since forever, and it has been used since the 18th century by different medical scientists to improve hot flashes, and it works wonders. Nowadays, we know it works not because it acts as estrogen, but because it acts in your serotonin receptors in your brain. So
Mhm.
it's a different approach
Wow.
to the problem. And again, it has been studied. There are meta-analyses showing that it really improves hot flashes and sleep.
Mhm.
And then we wanted to add something specifically for mood, because
Mm.
that's one of the issues that we have today. People complain a lot of mood swings, of depressive symptoms,
Mhm.
and it's hard today with all the stress and with all the things that as women we have to handle.
Oh yeah.
Definitely mental health is key. Back then I was living in Dubai and I got in love with saffron,
Mhm.
the golden spice. People
Yeah.
know it from paella
Yeah.
usually,
Mhm.
but it has been again used for centuries, and
Yep.
people drink it in tea, for example.
Mhm.
And it has been studied and it shows antidepressant effects. It's an anxiolytic, so it helps with anxiety and
Mhm.
is neuroprotective. And again, it works in the brain, more on the serotonin receptors, a very specific receptor. And that's why it helps with those depressive symptoms, with the sleep quality, and with something that it's also very important for us women, and it's with cravings.
Yes.
So it helps with cravings, and that's great because sometimes we feel desperate to eat something.
Right.
And that's part of the anxiety that we feel with changes in our hormones. So we decided to put these three ingredients together to make sure that we had, as I said before, a triple mechanism of action
Mhm.
that tried to tackle menopause symptoms from different perspectives in different ways, but that it was based all in science, that it had all the scientific support to make sure that things really work, and that have been studied for efficacy and also for safety, of course.
Yeah, I love that. All three of those are phenomenal ingredients. I love, and that's why I wanted to have you on because I said to you, there's a lot of stuff on the market that is sold to women. A lot of it not so good, a lot of it not really rooted in science. I love that you have all this evidence to back up what you're claiming about the product. And those three ingredients really are really beneficial and they could be very effective to a lot of women. So I love that you talked about all those, especially saffron. I feel like it's actually very underutilized, but it really can help with so many things, even if somebody's not in perimenopause or menopause. So thank you. Thank you for making a quality product. So while we're on that note, in regards to supplements, because there is a lot out there, and even as a health coach, I find it
Mhm.
not only hard to keep up with everything that's coming at me. I mean, I get a lot of people who, of course, want me to be an affiliate, or they want me to, they want to send me free products, and then they want me to try it,
Mhm.
and I say no to probably 95%, if not higher, because I don't really see the quality. I don't know if there's any evidence to back it up. I did a whole episode on supplements and just kind of what to look for, what to avoid. But, what should women be looking for when it comes to supplements to know whether or not it's legit?
Well, I think that it's hard. Let me say that. It's not easy because of regulation. There are a lot of things that people don't say.
Mm.
So I think the worst, and I have to mention this, is proprietary blends. And you see them a lot nowadays. They're everywhere, not only for menopause, but for everything, for sleep, for general health, for everything. And they're basically a combination of 10, 20, 30 ingredients in one.
Yeah.
And they tell you just, this is everything that I got in a supplement, and this is the total amount. But they don't tell you the amount for each ingredient. So it's a black box. I mean, you don't know what is in that. They can give you, and you can find some ingredients that you say, oh, that's good. So you can find combinations of saffron and ashwagandha and vitamin D and a lot of things that you would say, this is good. I've heard people talk about this and they're good, but you don't know how much you're getting from that.
Yeah.
I remember one that combined a lot of things and that it was like 1 gram. And just with 2 or 3, you just knew that it was impossible to get the right amounts, according to studies, in 1 gram for all those ingredients. So the first thing that I would say is stay away from proprietary blends. In Europe, in Latin America, they are illegal. You can only find that in the US, really.
I didn't know that. Oh my gosh, that is insane.
Yeah, you can check.
I'm not surprised.
Canada,
I'm not surprised. I mean, the regulations here are, we have a lot of work to do.
Yeah, definitely. So yes, that would be the first thing. The second thing is try not to get to try supplements which have a lot of things in them. Because again, for you to get the right amounts and the right doses of things, you won't get that in one pill usually. So what they are doing is cutting down on quantities, also to keep prices down. So sometimes it's really, if it's too cheap and it has a lot of things, it's probably not going to work.
Yeah.
And then you have to find and to ask for good ingredients, good quality ingredients. Let me give you an example on that. For example, people right now talk about turmeric. It's a great thing. The thing is that turmeric, what has been studied about turmeric is curcumin, that it's the active ingredient that really works as an anti-inflammatory. If you take turmeric, for example, in a tea, milk, some turmeric, some sugar, you're getting the benefits, but it's not a high dose. And that probably won't have a major impact in your health. Of course, if you've had a good diet and a healthy diet, all these things add up, but it's not going to have a therapeutic effect. For that, you need a good dose of curcumin, actually. So you have to find supplements that give you that amount of curcumin, not of turmeric, and then the ingredient has been developed so that it can be well absorbed. And we know this, we have known this for centuries. So in India, when they give you a turmeric tea, they put pepper on it because pepper improves absorption of anything. It opens the channels and makes the intestine absorb things better. So we know that turmeric has a hard time with absorption. So you have to find an ingredient with curcumin that has been studied to improve absorption of curcumin. And that's the kind of thing that, I mean, it's difficult to know because this, I mean, I've learned this in the past probably 5 years that I've been dedicated to researching supplements. And this is just one example of things. People talk about, for example, magnesium. The fact that we have different types of magnesium is because what changes is the absorption, and that changes the effect that it has in the body. Whether you want it for constipation or you want it for sleep, you have to use different salts to improve the absorption. So either you work with someone that knows about this kind of things, or you have to really do the work to research, knowing what you want, and then searching for the best ingredients and understanding which are the best ingredients to look for. And you can always say, okay, I want curcumin, and ask, Google and ChatGPT are great right
Yes,
nowadays for those things.
they
You
really
can
are.
ask,
It could be very helpful.
give
Yeah.
me names of ingredients that have been studied to improve the absorption of curcumin. And you can find a list and you can look for those in different brands.
Hmm.
Yeah. Saffron, for example. There are a couple of good brands of saffron. Afron is one. I remember the other one, but there are a couple, two or three very good saffron because you have to extract the active part of saffron to have the effect that you want. So that's a little bit difficult, I know, but again, I will always say either you do the work and investigate, or you look for people that know about these things so that they can help you select the best ingredients. And then something that it's super useful is to look for supplements that have certifications on third-party testing, which is basically a third laboratory, not the one that is producing the drug. It's not owned by the company producing it, but a third party that tests the supplement for impurities, for concentration of ingredients, for all these things, so that you can be sure you are getting a top quality ingredient and
Okay.
supplement, of course.
Yeah, I love that. Thank you. Those are wonderful tips. I really hope that women take this seriously because I mean, I feel for women because like you said earlier, they're just looking for symptom relief. And when they're bombarded with ads and, different people like on Instagram or TikTok who oftentimes are very confident and seem like they know what they're talking about. It's very easy to just buy whatever they're selling. And I say this a lot on my own Instagram, like just use discernment. Even if somebody has a huge audience and they're a well-known doctor or expert, just because they're selling you a supplement line doesn't necessarily mean that you need it or would benefit from those or that it's really of quality.
Supplements are tricky.
Mhm.
If you are not an expert and if you don't have experience, it's easy. It's easy to get lost in that world. There are a lot of CMOs, a lot of companies producing supplements. There are
Mhm.
a lot of companies selling ingredients, and you can find everything in between. People that are not very honest, people that, if you don't know about this, they can really, So I see also that influencers or people that are into health, once they have an audience, they want to have their own supplement, and that's great. I mean,
Yeah.
it's a nice business, and you're trying to help people.
Yeah.
And then they say, "Oh, I like this and this," and they go to the CMOs and tell them, "Please do this for me." And if you don't know what you're doing, they can just sell you not very good material, tell you, oh, this is cheaper. I can make this for $10 and you can sell it for 50 and easy peasy. And it's not. And there are a lot of people that have, again, good intentions,
Yeah.
but get trapped
Hmm.
in the science and in that business of supplement that is huge. And again, like every business, there are good people and bad people around. And
Oh yeah.
just trying to profit from things. So that's another problem that we don't talk about. I don't think that every influencer is trying just to be rich and famous and deceive people, but you have to know about these things.
I like to hope that most people are good intention, especially if they are in the health
Mhm.
and wellness space, but it's not always the case, unfortunately. And
Yeah.
it's hard to know who to trust. I get it. And again, I feel for women nowadays, but my goal, my passion is obviously bringing as much evidence-based education to the podcast and what I teach, and bringing experts like you on so that we could kind of cut through the noise a little bit, bring some clarity to this very overwhelming phase of life, in addition to all the conflicting advice that's out there. So I really appreciate this conversation. Thank you so much for being here. I just want to repeat what your supplement is. It's called Menoplay. I'm going to link to all this in the show notes. But how can women learn more about it? How can women find you?
So they can follow me on Instagram at Dr. Anna CD. And they can also find us in Amazon and in our webpage, eusari.com. And there they can find all the information about Menoplay, the three ingredients, Resequol, which is Sequol and resveratrol, black cohosh and saffron. And you can see the studies there. You can see our third-party testing and everything that you need to know about our product. And also a little bit about menopause, what works, what doesn't work. I love to, as you said, try to bring good quality information for women, but also with a little bit of fun and, it's not only science, but also what fits our life, our needs, and our goals, right?
Yes.
So that's what I try to keep in mind every day.
Yeah, I love that. Thank you so much for being here. All right, ladies, until next time. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.